Hi, everybody. I'm Dr. Usmani here at Delaware Smile Center in Middletown, Delaware. And today I want to go over just some different treatment options that people have for scenarios where either their teeth are failing, they're unable to restore them with traditional methods of dentistry, so they're looking at alternatives, okay? One of those situations where we end up having to lose teeth altogether more traditionally is like a traditional denture, right? And that's what something like this is. Essentially, it's a piece of plastic that would be put into the mouth, and we try to keep it there best we can in order to get as much function out of it as possible. But it just doesn't work the way that we would like it to work because it is a removable appliance. The only real advantage of a traditional denture is economic at this point. Aside from that, it doesn't do anything else to really support the health of the mouth. There's continued loss of bone with a traditional denture. And again, function is just not where it needs to be. Fortunately, technology has improved over the years, and there's been many advancements which has helped us come up with different treatment options. And the one I want to talk to you about today is what is known as an All-on-4 or a teeth in a day process or dental hybrid. A lot of different names. It's essentially the same process. With that system, essentially what happens is the teeth are removed and we can put implants in once we clean out any of that bacteria or infection that might be there. We place the implants into that nice solid bone. Once the implants are in position, we can go ahead and actually the same day put in teeth. When the patient comes in, we remove the bad teeth, get the good implants in, and then go ahead and place a set of temporary teeth, okay? This actually, what I have in my hand is a sample of what the temporary teeth look like. It's very functional. Aesthetically, they look very nice as well. We let that sit in place for about a good 4 months so that the tissue and the bone and the implants everything can stabilize. And after that 4-month period, we make another set of teeth. So we can use a zirconia material to go ahead and do the final version of the teeth, which it's a much stronger, much prettier material. That material will go in place, and then we will essentially keep you on a regular maintenance program to keep things clean and healthy, okay? That summarizes kind of start to finish what is involved with doing a all-on-4 technique. So some common questions that we get in regards to this type of treatment is, does it hurt? The reality is we are doing a surgical procedure. I mean, you're taking teeth out, you're putting in implants. So that process is definitely going to have swelling, inflammation, things that are associated with it. But surprisingly, it's usually about 4 to 5 days and then things start to settle down pretty nicely, okay? It's very rare that anybody has any discomfort beyond a week or so. It's very atypical. But yes, there's going to definitely be some swelling and some discomfort associated with those a few initial first days there. Another common question we get is, how long until I can get my teeth? Good news on that is the day you come in for the actual procedure is the day you leave with teeth. So that's kind of one of the biggest highlights or benefits of this procedure. Now, the teeth that you get that day are not your final set of teeth. It's a temporary set of teeth that we put in place because during the healing process, there's a lot of changes that are going to occur with the tissue and the bone and things of that sort. So we want to make sure that everything has fully healed before we go ahead and make the final set of teeth, because it takes a great deal of refinement and artistry to get to the point where you're going to have that perfect, beautiful smile. Taking care of your new teeth is another common question. Really with that, home care is very important, as well as regular visits to your dental office so that we can maintain that as well. At home, a combination of a water pick, toothbrushing, and flossing is going to be really beneficial to make sure that the tissue and everything stays healthy for you. And then when you come in for your dental cleanings, we do a very thorough examination to make sure everything is healthy. And then we can get in with special instruments to make sure everything is removed and clean. Another common question we get is, what are the things that we can eat with this type of treatment? And the good news is this is the best treatment out there for you to be able to eat and consume the foods that you would with natural teeth, okay? You don't have any limitations in terms of apples or corn on the cob or steak. These are all things that are now open to you to go ahead and consume and enjoy as you would with natural teeth.